Hello, welcome to Health Chat. I'm Dr. Alantia Wynn, and today we're going to be talking about diabetes. Now, everyone has heard about diabetes. Some people also call it blood sugar being too high or just the sugar. But what is diabetes really, and why is everyone so concerned about it, and why do we need to make sure we take care of it? First of all, what is it? Diabetes is defined as a chronic condition in which the body is unable to control the amount of glucose in the blood. Glucose is a form of sugar. It's the most basic form of sugar that there is. All the other forms of sugar in food eventually gets broken down into the sugar we call glucose in the bloodstream. Now, glucose in and of itself is a good thing because the body needs glucose for the energy. That's where you get the energy from the foods that you eat. The problem comes in is when you have too much of this glucose in your body. Now, normally the amount of glucose that your body has is controlled by a hormone called insulin, which is produced by the pancreas. Now, the pancreas is an organ that is in your body. It's in your abdomen. It is sort of in the back. It's behind let me show you where it is. So this is your liver right here, and then behind that is your stomach, and then behind that is the pancreas. So it's more kind of in the back of your body. So that's the organ that produces this insulin that your body uses to control the blood sugar. Now, when someone develops diabetes, that is because either the body is making too little insulin, which is what we call type 1 or insulin-dependent diabetes, or the cells of your body are unable to use that insulin, and that's what we call type 2 diabetes or non-insulin dependent diabetes. Type 1 diabetes is the type that's usually diagnosed in children, teenagers, maybe young adults. Now, we consider that what's called an autoimmune disease. What's an autoimmune disease? That's when your body starts to attack part of itself, whether it's an organ, whether it's skin, some part of your body is damaged because of that. And so when the body attacks the pancreas, then that's when it doesn't produce the insulin. Now, type 2 diabetes is the type, like I said, it can be diagnosed in adults, but it also can be diagnosed in children as well. In that type of diabetes, the cells are what we call resistant to insulin. We don't know why it's caused. We don't know what it comes from. But the body is still producing the insulin, so the poor pancreas is just pumping out that insulin and pumping it out, but the body doesn't use it. And so the insulin levels in the bloodstream are actually higher than they should be. But because the poor pancreas is working itself to death, it eventually does fail. And so at that point, the people who had been what we call non-insulin dependent diabetics then become insulin requiring diabetics. And because the body no longer has that insulin. So who develops diabetes? There are different types of things that can lead to people developing diabetes. In type 1, the one that is typically developed in children, the most common risk factor for that is family history. So if you have a lot of people in your family who have diabetes, that increases your risk for developing diabetes as well. The type 2 diabetes or the non-insulin dependent diabetes, family history plays a role in that as well. But also other risk factors for that are being overweight. If you are a woman and you develop diabetes when you were pregnant, that increases your risk for developing this type of diabetes later on in life. Also, if you have a sedentary lifestyle, if you just never really exercise, that can increase your risk for developing that as well. Other things that can lead to that risk are high cholesterol, high blood pressure, those type things. So now that we know the people who are at risk for diabetes, how do we know if we have diabetes? Sometimes you can have diabetes, you can have a very high blood sugar and not have any symptoms at all. But some of the more common side effects or some of the more common symptoms of diabetes, whether it's the type 1 or the type 2, are feeling tired all the time, feeling really thirsty, having a very dry mouth, having an increase in your appetite, just never feeling like you can get enough food. Also, some people can develop weight loss. Another symptom is having to urinate frequently. You can also develop blurred vision, again, just feeling weak and tired. It also increases your risk for developing infections, whether they're skin infections, bladder infections, throat infections. So if you start developing lots of infections, you might want to see your doctor to have them check you for diabetes. Now that we know the people who potentially can get it and know when someone comes in and say, I have these symptoms, how do we diagnose it? There are several different ways. Most commonly is first the doctor will ask you a lot of questions about your family history, will ask about any symptoms you might be having. Even if there are symptoms that you hadn't really thought about, they would ask you if you're having any of these other symptoms. Once they determine that this might be diabetes, then they'll do some blood tests. And there are several different blood tests that we can do to test the blood sugar to determine if in fact this is diabetes or if it's something else. The most common thing that we do first is what's called a fasting blood sugar, or we can also do a random blood sugar. And that's when you come into the office and you have the doctor test your blood sugar at that moment. And that's telling what your blood sugar looks like just at that moment. That can be affected by what you had for breakfast that day, or what you had for dinner the night before, or also if you've been very active. There are a lot of different things that can affect that. So that's not the best way to determine the diagnosis. It can definitely increase the likelihood that it's diabetes, but it doesn't necessarily mean that you have diabetes. The two tests that we use for the diagnosis, we can either do what's called a glucose tolerance test, and a lot of you ladies out there who've been pregnant are familiar with this one because we do a similar type test when you're pregnant to determine if you are developing diabetes during pregnancy. In that test, you go to a lab where you haven't had anything to eat or drink that morning. They test your blood sugar, and then they give you a bottle of really sweet stuff to drink, and then you have to go back every hour for the number of hours that your doctor has prescribed. It's usually either 2 hours or 3 hours, and they test your blood sugar each time you go, and they determine what your blood sugar is doing in response to the sugar that you drank in that really sweet stuff. And based on how your blood sugar responds, that determines whether or not you have diabetes or not. Now, not everyone needs to have that test done because, again, not everyone can have time to go to the lab and spend 3 hours getting a test done. So we can also do a test which is called a hemoglobin A1C. And that test is a test that will determine what your blood sugar has been averaging over the last 3 months. It is a test that is a form of hemoglobin, which is one of the proteins in your blood, and sugar can attach to that type of hemoglobin, and so that's what that test measures. And so it gives us a number which explains and demonstrates what your average blood sugar has been over that last 3 months. So that is not affected by what you have done in the last 24 to 48 hours like the fasting blood test would be or the random blood test would be. And it's just a simple blood test, so you don't have to spend so much time in the lab like you would for that glucose tolerance test. But any of those tests we can use to determine if you have diabetes or not. And a lot of times your doctor will order more than one of those tests. So now you've been diagnosed with diabetes, either type 1 or type 2. So then you have to think about, okay, well, what are the things I have to worry about if I have diabetes? Because I'm sure you've probably heard people say, oh, if, I had a friend or a relative who had diabetes and they developed this or they developed that. So the things that you have to worry about when you have diabetes primarily are due to the diabetes affecting the circulation. So it affects the blood flow in various parts of your body, various organs in your body. It can affect your kidneys. It can affect your heart. It can affect just the blood flow in your veins, or it can lead to amputations, or it can lead to vision loss. It can sometimes cause damage to the nerves, which will cause numbness or tingling or prickling in your fingers or your toes. It can lead to increase in infections. And so those are the things that you really have to watch out for. And the longer you have diabetes, especially the longer you have diabetes that is not well controlled, that increases your risk for those type of complications. Unfortunately, sometimes people who don't go see their doctor regularly, by the time they get diagnosed with diabetes, they may already have some of those complications. And so then it's just a matter of making sure that those complications don't get any worse and preventing any additional complications from occurring. There are several different things that we can do to treat diabetes. It's not that, oh, once I have diabetes, there's nothing I can do about it. The most common thing that you want to do is, of course, watch your diet and exercise regularly. A lot of times your physician will send you to a dietitian to explain the ways you want to eat when you have diabetes, because it's not just about watching the calories that you take in. It's watching the carbohydrates you eat, is managing the amount of sugar you have in your diet, is making sure you have all of the nutrients that you need, all the protein, make sure everything is balanced. So a lot of times a physician will send a newly diagnosed diabetic to a dietitian just so they really understand what having diabetes is all about. Now, people who have the type 2 diabetes, the non-insulin dependent diabetics, a lot of times they can take just medication by mouth. They can take pills for the diabetes, and that can control it. The people who have the type 1 diabetes, they need insulin right away because, again, the pancreas has been attacked, so the pancreas is not producing the insulin. So there's no insulin in the body, so they need insulin as soon as they're diagnosed. The type 2 diabetics, usually they start off with pills, but as they're going along, as their poor pancreas poops out and they start having less insulin around, a lot of times they will need insulin as well. It's not that they did anything wrong, that they didn't control their diabetes, and so that's why they have to take insulin. It's a natural course of the disease that eventually they will need to have insulin as they go along. And also, going back to what I talked about, diet and exercise, the main thing you want to make sure is if you are overweight and diabetic, you want to work on losing some weight, because losing weight will help keep your blood sugars under good control. And sometimes even just losing 5% of your body weight or 10% of your body weight will help get your blood sugar under control. And sometimes, depending on how much weight you lose, I've even had patients who have not had to take their medicine anymore. They can just control their blood sugars with their diet and their exercise. And as long as they're eating healthy and keeping their weight at a normal, healthy range, then they just need to watch their blood sugar and they don't need to take any medicine anymore. Having said that, of course, the thing you want to do most often is to see your doctor regularly when you have diabetes. And your doctor will tell you how often you need to come in. A lot of times when you first get diagnosed, you need to come in more regularly as they're changing your medicine and regulating and making sure you understand everything, making sure you're taking your medicines properly, making sure that you are on the right dose of the medicine, because sometimes when you first get diagnosed, you need to have your medicines adjusted and changed to make sure that you are on the right regimen for you, because everyone's a little bit different. So not everybody can take the same medicines in the same doses at the same times in the same combination. And sometimes people need to test their blood sugar at home. I get asked that all the time. Do I need to check my blood sugar at home now that I'm diabetic? It depends. People who are insulin dependent, the type 1s who are taking the insulin, they do need to check their blood sugar because their blood sugar can change very rapidly, very frequently, and it's a lot harder to stay in good control on a regular basis, so they have to keep a closer eye on their blood sugar. People who have type 2 diabetes usually do not need to check their blood sugar when they first get diagnosed, depending on how high their blood sugars are. Obviously, if the blood sugars are really high, then you may need to keep a closer eye and they may need to test their blood sugar. As their disease progresses, even if they haven't been checking their blood sugar at home at the beginning, sometimes they will need to do that as they go along, especially once they get to the point where they need to start taking the insulin. And usually when you're diagnosed, once your doctor determines that you do need to start testing your blood sugar, he or she will either show you in their office. Sometimes they have a nurse in their office that will show you how to use the machine. It's called a glucometer. Sometimes they will do it themselves. Sometimes they will send you to what's called a diabetic educator. Now, diabetic educator is usually a registered nurse who has had specialized training in teaching people about diabetes. They don't manage your diabetes, but they definitely help you manage it. A lot of times they will answer any questions you might have. They will make sure if you are testing your blood sugar that you're testing properly, testing at the right times, help you understand what those readings mean, because sometimes if you're testing and you get all these numbers and you don't know what these numbers mean. So the diabetic educator is definitely a big part of the diabetic team. Because when you have diabetes, you need to have a team around you. And that team is going to be your physician, or if you're seeing a nurse practitioner, then they will do it as well. But the key is the doctor is the person that you really want to stay in close contact with so that you can get all your blood sugar under control and maintain it. And so that will help you live a normal, healthy life. Because a lot of times I also get asked, is this going to impact my life? How is this going to affect me overall? Do I need to stop doing the things I enjoy doing? Do I need to stop going out with my friends? Do I need to stop working? What do I need to do? So a lot of times your physician is the best person to ask those questions. And also a lot of times you can find support groups that will help you, especially when you first diagnosed and you have all those questions and you're really confused as far as what all this means. Sometimes talking to someone who has been in your shoes and someone who has had diabetes for a number of years and are living a normal life and they're doing everything that they want to do and they're keeping their blood sugars under control, a lot of times that will help you feel like you are more in control. So if you do see a diabetic educator, a lot of times their group will have support groups that you can join. Sometimes they'll have group classes that you can attend where everyone is newly diagnosed and everyone's asking their questions. And that's really good too, because sometimes someone will ask a question and you're sitting there thinking, oh, I didn't think about that. That's a good question. So a lot of times the groups will help a lot. But the main thing is, you don't want to go onto websites where you see all the horror stories and you see all the things that will scare you to death. You really want to talk to your physician so that they can explain what's going on with you and your level of diabetes and what you need to do to take care of yourself. Because diabetes is such a vast disease and everybody is a little bit differently. So just because you have had family members who have had to have things amputated or they lost their vision or some other complication does not mean that you're definitely going to have that. The key is to get your blood sugar under control as soon as possible, keep it under control, see your doctor on a regular basis, see the nutritionist if that's something you need to do, talk to the diabetic educator, because again, as I said earlier, it's a team. So everybody's part of your team. Your physician, nurse practitioner, the office staff, the diabetic educator, nutritionist, dietitian, family members, because the other thing too is not just you, if you've gotten diagnosed with diabetes, it's also the whole family, because it will change the way you need to eat. It will make you need to start exercising if you've not exercised before. So a lot of times it's a change for the whole family. So it's not just you changing your lifestyle and no one else has to change anything else. So a lot of patients do find it helpful that when they first get diagnosed, they have their spouse or their life partner or their children or whoever is in their social circle come to their doctor's appointments with them to help explain to this other person what this will mean as far as when you eat and what you eat and why you need to change the things you're changing. Because it really is a lifestyle change. It does not mean it's a negative lifestyle change, but it is going to be a lifestyle change. There are going to be certain things you need to do. If you are insulin dependent, you'll need to take shots and you'll need to figure out a way to do that at work if you need to do that during the day, or at school if you're going to school, and you'll need to be able to give yourself the injections, which is something else the diabetic educator can show you how to do if your physician's office does not. Because a lot of people do get a little nervous when it comes to giving themselves injections, and also the finger sticks when they're testing the blood sugar. Sometimes people get a little nervous about those kind of things, but those are the questions that you want to talk to your doctor's office about, because they will help you with all of that. The key is you don't want to get nervous and just say, oh, I can't do this, I'm not going to do this. Anything you're having an issue with, talk to your physician, and he or she will definitely help you figure out exactly what it is that you need to do. And if it's something that you can't do, then they can figure out something else that might work as well. Same thing with any medicine they start you on. If they start you on the medicine and you're having a side effect, don't say, oh, well, I'm just not going to take this because I'm having this side effect. Talk to your physician, because they will not know what's going on unless you tell them. Same thing with any symptoms that you might have. So if you went in because you were having fatigue, and then that gets better, but then you suddenly start having some numbness that you weren't having before. You want to let your doctor know that that numbness is going on, because again, that could be a sign that you need to get your blood sugar tested sooner than they thought that you would need to do, or they need to maybe change a medicine, or they need to do something else, or look to see if it's caused by the diabetes or if it's caused by something else. Because the key is communication. The two-way communication is, I can't describe how important it is in diabetes. It's true for any disease, but especially in a chronic illness like diabetes, where you really do have to take care of yourself. So you need to let your physician know what's going on so that he or she can help you, guide you. And if you have any questions or any concerns, that's the main thing that you want to do. And so when you get diagnosed, ask those questions. When you first get diagnosed, write questions down. If you can't think of anything, write them down as you think about them. Call your doctor or bring them all in with you for your next appointment. Because sometimes you don't think about things until you're sitting at the dinner table or you're sitting in the restaurant and you're thinking, oh my goodness, I don't know what I'm supposed to eat. I know they told me, but I can't think of it. I don't know if they said I'm supposed to have carbs, if they say I'm not supposed to have carbs, if they said I'm supposed to eat protein or not eat protein, or I don't know what to do. Those are the kind of questions that you want to, at the time you're sitting there, say, let me write this down so that next time I'm in my doctor's office, I can ask him or her about this, or let me call if it's something that's really, you don't feel like you can wait to your next appointment 3 months or 6 months down the line. Write it down, call your doctor's office and say, hey, I was out last night and I had this and I don't know I didn't know what to do. So this is what I did. So is that what I should have done, or what should I have done? And that's a good way so that you know what to do next time. So you don't want to beat yourself up and say, I didn't know what to do, so I didn't pay attention. Because when you get diagnosed with diabetes, it's a lot of times it's a huge, people hear that word and they immediately go to all the bad stories they've heard about diabetes ever. And so a lot of times it is hard to remember everything that you're told at that time. And plus you get told a lot of stuff at that time. I mean, we've been talking for 25 minutes here and we still haven't just barely even scratched the surface as far as diabetes. And so it is hard to listen and remember everything that your doctor tells you at the time you are diagnosed. So take notes as they're talking to you, things that come up later. If you don't remember what they said, call. There's no such thing as a silly question. Your doctor will not think less of you for asking questions. In fact, he or she will probably be happy that you asked the question rather than trying to guess or trying to maneuver this on your own, because that's what they're there for. They're there to help you with your health and make sure that everything is well taken care of. One thing I did not mention is that when you are a diabetic, you do need to make sure that you see your eye doctor on a regular basis as well, because of the risk to your eyes, because sometimes it can start to affect the little teeny tiny blood vessels in the back of your eyes long before it affects your vision. So I always recommend that all my diabetics see their eye doctor every year to get an exam and have them do a dilated exam where they dilate your eyes so they can really look in the back of your eyes to make sure that the diabetes is not affecting your vision or your eyes. And your physician will also recommend other things that you will need to do on a regular basis based on the fact that you are now a diabetic. You'll need to start getting a flu shot if you haven't been doing that. There are lots of other things that you will need to do to really take good care of your health in general, not just your diabetes, and as well as taking care of your health, any other issues that you might have in addition to the diabetes, because the diabetes can affect your high blood pressure, your cholesterol, any other illnesses you might have. So in general, diabetes is a potentially serious diagnosis, but as we've talked about here today, it can be managed with lifestyle changes, diet, exercise, medications, making sure that you are well controlled and in good conversation with your healthcare provider. So I hope I have given you a little bit more insight into diabetes that you may not have had before. But if you have any questions, or if you already have diabetes and this is brought up some questions that you did not talk to your physician about, I would definitely encourage you to talk to him or her about anything that we've talked about today that you have any questions about. So I hope you have enjoyed spending this time with me. I certainly have enjoyed spending this time with you and chatting with you. And I hope that you have a wonderful, wonderful day. And I'm Dr. Alancia Wynn, and this has been Health Chat, and I will see you next time.